providing privacy for my patient and doing my hand hygiene. Hi, Mrs. My name is Raven. I'll be your nurse for today.
Hi, Raven.
Hi. Could you verify your name and your date of birth for me?
Sonia Toots, November 3rd, 1975.
Can I see your receipt and confirm? Great. All right, Miss Toots. So your daughter has some orders for you. We're going to do your vital signs, which includes your blood pressure, your respiration rate, and your heart rate.
Okay.
And then we're going to do a cardiovascular assessment and your respiratory assessment.
Okay.
Alright, so Miss Toots, are you in any pain today?
A little bit, yes.
A little bit? Okay. What were you doing when this pain started?
I was doing some yard work.
How would you describe the pain? Is it achy? Is it burning? Is it sharp?
Achy.
Achy?
Mm-hmm.
Okay. And where would you locate the pain?
My right knee.
Your right knee? Okay. Is it localized to that area or is it moving to other extremities?
It's localized.
Right. Why would you rate it on a scale 0 to 10, 0 being no pain, 10 being the worst pain?
About 5.
And then when did this pain start?
Yesterday.
And can you tell me how this pain affects your day-to-day activities?
Well, because of the pain, I'm having a hard time doing my chores.
Okay, all right, sounds good. All right, I'm gonna get this charted, your notes charted, and we're going to move over to your blood pressure.
Okay.
Sorry. Is that good for you?
Yes.
And Ms. Toots, are you on any hypertension medications?
No.
And are you having any no allergies?
No allergies.
Alright, we just want to make sure that your feet are placed on the ground and you're not crossing your legs.
Okay.
Relax your arm. Okay. Awesome. Ms. Toots, could you just let me know your baseline?
Well, it usually runs about 120 over 80.
Okay, thank you. Alright, Ms. Toots, I got 114 over 62. Good blood pressure. So now I want to get your pulse and your respirations, okay?
Okay.
Do you mind turning your hand at your arm in? Thank you. Alright, let's do this. We got about 18 for your respirations and 66 for your heart rate.
Okay.
Alright, so now Ms. Seuss, we're going to move on to the cardiovascular assessment.
Okay.
Alright, Ms. Seuss, so are you having any shortness of breath?
No.
Any chest pain?
No.
So now Ms. Seuss, we're going to check for your jugular vein pulse. So do you mind just sitting at a semi-Fowler's position at a 45-degree angle and just turn your neck to your right side for me? Good. And I'm just checking for the distension of the jugular vein. Alright, and I'm going to come over to the other side. Do you mind turning to the left? Alright, good. Seuss. I don't see any distension on your jugular veins, right? So now I'm going to check for the palpating of your pulse, for your radial, your dorsalis, and your posterior tibial.
Okay.
So do you mind just holding the wrist? And that is about a 2+, which is a normal pulse rate.
Okay.
Now I'm going to check your feet for your dorsalis.
Okay.
Just rolling up your pants. That's also about a +2 for your pulse and your dorsalis, which is normal.
Okay.
So now we're going to check for your posterior tibial. Alright, and that's also a +2 for your pulse and your posterior tibial, which is normal as well.
Okay.
I'm also just going to point out the other pulses, which is your popliteal, which is in the back of your knees. Alright, then we'll do your femoral, which is in your groin area. And then also your brachial. And your axillary. Can you hold your arms up for me? Okay. Also, you put your hands up, and then your carotid artery. We're just going to do one side at a time.
Okay.
Just showing where that's located. Alright, great. Thank you, Sid. Alright, so now we're going to do the capillary refill, which is just checking your refill of your blood on your fingertips. So just going to press down. We just want to make sure that it's refilling at a 2 to 3 seconds.
Okay.
Alright, great. Those look great, Ms. Suits. Now we're going to move on to check for your lower and your upper extremities for edema.
Okay.
So I'll just start at your bottom and work my way up to the top. I'm just going to touch your feet and feel for any swelling.
Okay.
Okay. And can you just stretch your arms out for me? I'm going to start at your hands. Alright, good. I don't feel any swelling, Ms. Suits. So now we're going to oscillate your heart sounds using the diaphragm on my stethoscope.
Okay.
So verbalizing that I am putting the stethoscope on my patient's skin in contact with the patient's skin. Listening to the aortic. Moving over to the pulmonic. Listening to the herb sound. Alright, Ms. Susie, you mind just lifting your left breast for me, please? Now listening to the tricuspid sound. And moving over to the mitral sound. Alright, perfect. Thank you, Ms. Susie. Everything sounds good. I'm going to use the bell side of the stethoscope to listen for any murmurs.
Okay.
So we're just going to do that process again. The aortic sound, the pulmonic sound, herb sound, hemostatic respirators, tricuspid sound, and your mitral valve sound. All right, sounds good. Thank you. I didn't hear any murmurs. Okay.
Great.
That's the end of the cardiovascular assessment. Now we're going to move over to the respiratory assessment. Okay. All right, Ms. Two. So, have you had any shortness of breath?
No.
No. Have you been coughing a lot or anything?
No.
Okay. All right, Ms. Two. So now I'm just going to take a look at your respiration rate as well.
Okay.
Just going to check out the breathing pattern. Okay.
Okay.
I'm not going to touch you. I'm just analyzing your chest.
Okay.
Preferences for your respirations, I got 16, and your breathing pattern seems to be regular, which we call that from 12 to 20 respirations, we call that eupnea.
Okay.
Alright, so now we're going to escalate your breathing sounds using, I'm going to do your front anterior side, and then I'm going to do your lateral, and then your posterior, which is your back, okay? And I just want you to take deep breaths for me.
Okay.
Right upper lobe, left upper lobe. Alright, you mind just lifting your breast okay. Right lower lobe, and lift your other right lower lobe. Great. Alright, Mr. Do you mind just crossing your arm over so I can check that lateral side?
Okay.
Great. And can you just cross the other arm for me? Okay. Mr. Do you mind just turn around so I can get your posterior back side? A little bit more. Thank you. Left upper lobe, right upper lobe, right lower lobe, left lower lobe. Alright, good. This sounds good. Okay, it was very clear. So now, Mr. we wanted to use this is called a sedative spirometer.
Okay.
And we're going to use this to, we're going to use your sedative spirometer to help with the mucus in your lungs so that it doesn't build up and it loosens it, and so that things like pneumonia are caused.
Okay.
Okay, so this is using the sedative spirometer, you're going to take deep breaths in, and you're going to hold it for 2 to 5 seconds. And you exhale, and you're gonna do this every 10 times in 1 hour.
Okay.
So like a commercial break would be a great time to use that.
Okay. Okay, great.
So do you mind showing me or say back what I just told you?
Okay. So take a deep breath in, and then I'm gonna hold it for 2 to 3 seconds. Okay.
Great. Great. So you got the technique. It's
Yes.
thank you. And also another technique to help with loosening that mucus in your lungs is also the cough and turn exercise.
Okay.
So you can do that every 2 hours. You can turn to your left, take a deep breath in, and then cough. And then you would do the other side in another 2 hours. Yes. Great exercises too. Alright. So since that's the end of our assessment, I'll get over these documents to the doctor. And is there anything else we can do for you?
All right, and thank you so much for taking great care of me.
You're so welcome, Ms. Stu. Thank you so much.